It's time for us to receive our next guest. Shalo-Fuh Therese is a clinical therapist, over 12 years of counseling experience, and also the founder of Be the Exception Counseling Foundation. She's here to answer some of the deep questions we've been asking ourselves throughout the season with violence in communities, in families, in schools. She's here for the answers. You're welcome.
Thank you.
How are you doing this morning?
Doing well. Thank you for having me on the show.
Okay. I have just a quick personal question for you first. Why did you choose to become a clinical therapist?
No, that's a very interesting question. My mother, my late mother, she helped a lot of people in her own way, and I think that concern and compassion that she had, seeing what it did for the community in the Southwest region, kind of rubbed off on me in the beginning.
Okay.
Yes.
Now, I'm sure that's why you created Be the Exception Counseling. What does it actually do?
Be the Exception Counseling, it's a treatment center that is located in Limbe, and what we do there is we provide counseling and case management for substance use or alcohol use disorders, mental health, stress management, anger management. We also deal with aggression and student violence because we know we have that in the rise. And we also go into doing rapid drug screen tests. So basically you come in, you pee in a cup, and we test and we tell you what drugs and alcohol are in your system and what you should do. So we offer 13 services.
Let's select some of these services and talk about them.
Okay.
I'm keen on talking about drug addiction because it's an issue in our community, in our society. How do you help someone who is addicted to drugs?
You know, there are 3 different criteria for drug and alcohol abuse.
Yes.
And usually they fall under mild, moderate, or severe. And when somebody is mild, that means they meet 3 criteria. For example, they may not be coming home, they may start failing at school. If it's a student, they may start getting violent or getting into trouble. So that's just 3. So that's mild, right? And then moderate, they meet a criteria of 4 and 5. And then severe cases are from 6 and up. So how do we treat them? We offer individual, group, and family counseling sessions. We are also transitioning into a clinic where we'll be doing detox off of the drugs and also daily medication management in Limbe. And it's very rigorous. We write treatment plans for you, we give you tasks, and you have to follow every single step we give you for the next 3 to 6 months or more until you are well.
Okay, have you dealt with some of these drug addicts, if I can put it that way, in Cameroon in your clinic so far, and what have been some of the difficulties?
We do have, yes, we've had a very rise case of, or cases of substance use and disorders with the student population, especially our youths, and that goes from ages 10 and up. And that's very, very
10.
crucial. Yeah, oh yes, 10 and up. And these cases, how do we do this? We go into the community sometimes and we do outreach, and we talk about, you know, what we offer and what we can do. And then when they come in as well, now we sign them up. The challenge we're having is that most of them, when they come in, they expect that treatment is free. And that is a problem because it's a service we're offering you, but at the same time also you are getting better and you're trying to invest. So that's one of the challenges we have. The second challenge is the fact that we state that you know, mental health and substance use and all these things that we offer, there's not only a fee for it, but the fact that they have to stay consistent, whether it's with drug use or alcohol use counseling. That's another problem, staying consistent.
We're going to talk more about that, but that's going to be after this commercial break.
Okay, thank you.
Aujourd'hui, nous voulons tous voir les choses changer. Avec le lancement de la 2e phase de la vision 2035, les pouvoirs publics s'activent et vibrent au rythme des aspirations des citoyens. Pour allier le discours aux actes, à travers de nombreuses politiques, le gouvernement encourage les acteurs des secteurs publics et privés, chacun en ce qui le concerne et dans son champ d'activité, à contribuer au suivi et à la mise en œuvre de notre stratégie nationale de développement SND30. Gouvernants et gouvernés, retrouvons-nous à la 11e édition du Salon de l'Action gouvernementale SAGO du 22 juin au 1er juillet 2022 au Palais des Sports de Yaoundé sous le thème « Modernisation de l'administration publique camerounaise comme levier majeur d'atteinte des objectifs de la SND30 ». Pour plus d'informations, contactez le cabinet événementiel Mon Communicateur, mandataire du gouvernement au 677 88 63 22 ou cliquez sur www.sago.cm. Salon de l'action gouvernementale, la vitrine du Cameroun.
Le Cameroun, une terre d'opportunités. Pour garantir l'attractivité économique, sociale et culturelle des territoires, les pouvoirs publics, de concert avec les collectivités territoriales décentralisées, les acteurs du secteur privé et les populations sont condamnés à agir ensemble. Sous l'impulsion de la communauté urbaine de Kribi, participez au Salon des acteurs économiques et du développement local SAEDEL du 3 au 11 décembre 2022 à Kribi, au bord de l'océan Atlantique. Profitez de 10 jours d'échanges, de partenariats, d'expositions et de visibilité de votre savoir-faire. Pour plus d'informations, contactez le cabinet événementiel Mon Communicateur au 6 77 88 63 22 ou cliquez sur www.saedel.cm. Salon des acteurs économiques et du développement local. Ensemble vers l'émergence.
In conversation with clinical therapist Shalo-Fuh Therese. We're talking about healing ourselves physically, mentally, spiritually. There's a part of the healing you do in your therapy sessions, which is energy healing, meditation. How is that important and how do you do it?
So meditation instruction and energy healing is very important. You know, a lot of us, we forget that we have, so there's the spirit, the soul, the mind, and the body. Mm-hmm. And you're treating your mind, right? I mean, if you have cancer, for example, you treat your mind. Mm-hmm. You go into the hospital, you're treating your body. But also the spirit and soul could be depressed, could be down, because you know you're suffering from cancer. So too is substance use. Substance use is the disease of the brain. Mm-hmm. And we actually have two brains. We have one in our brains, in our heads, and we have one in our stomachs. It's the gut area. Mm-hmm. So with energy healing just basically means touching energy centers in your body through chakra alignments and putting them together so that you start feeling one again with yourself and you start being aligned with your insight, with your intuition, and you start feeling whole again. There are certain meditations that I do that are very strategic to anxiety, depression, schizophrenia, or schizoaffective disorders, and they heal as well. And prayers are also part of meditation. You know, some people do that. So it's all an incorporation of a lot of things that I incorporate.
Yeah. Mm-hmm. So how do you deal with people who have violent tendencies?
Oh, I've had many. I've been doing this for 15 years, and violent tendency comes in different forms. We have those who throw things, break things. Mm-hmm. We have those who scream and beat you up. And we have those who just curse you out, but they don't really do anything. And you have to understand that different types of violent tendencies come with different types of mental health disorders and also drug and alcohol abuse that increases or causes violent tendencies. Mm-hmm. And so a lot of people, they lock up their children or their parents or grandparents in a house, in a room, because they are afraid of what they can do.
But how do you help them? Because we have about a few seconds before the news. How do you usually help them?
So basically what we do is we do meditations with them. We also do what we call cognitive behavioral therapy and dialectical behavioral therapy. There are different types of forms of therapy that we use to help them walk through their anger and find out what the source of that anger is and what the source of that issue is.
So Therese, if we want to contact you for more information, how can we do so?
My phone number is, we have 3 phone numbers. We have WhatsApp, +1 512 383 6030.
Okay, and if you want some more information, maybe you go on social media and type Be the Exception Counseling, and you get all of the information. You can reach out to Shalo-Fuh Therese, whom I'm sure will come back to the program because we have a lot more to talk about. But right now it's time for the news, and we'll be right back after.